Good afternoon and welcome to a webinar on temporary labeling modifications during COVID-19 presented by EAS Consulting Group's independent consultant, April Cates, and American Bakers Association Senior Vice President for Government Relations and Public Affairs, Lee Sanders. EAS Consulting Group is a member of the Certified Family of Companies and is a global leader in regulatory solutions for industries regulated by FDA, USDA, and other federal and state agencies. Our network of over 150 independent advisors and consultants, including experts in labeling, enables EAS to provide comprehensive consulting, training, and auditing services, ensuring proactive regulatory compliance. The American Bakers Association is a Washington, D.C.-based voice of the wholesale baking industry, representing the industries of bakers before Congress, federal agencies, and international regulatory authorities. Our presenters today are April Cates, an independent consultant with EAS, who has previously served as the Supervisory Consumer Safety Officer for the Product Evaluation and Labeling Team at FDA's Center for Food Safety and Applied Nutrition. She is joined today by Lee Sanders, who leads the ABA Government Relations Team, representing the baking industry before Congress, federal agencies, and international policy-making bodies. She is also co-chair of the Food, Beverage, and Issue Alliance, a group of 62 FDA-regulated food industry trade associations that work together to develop unified positions on nutrition and food safety issues with FDA officials. With that, I'll say thank you for joining EAS, and I'll turn the presentation over to April.
Good afternoon. I'm April Cates, and I'd like to talk about these challenges, which are on top of the challenges of the COVID-19 pandemic as well. To start off, let's quickly review how we got here. I know it seems like 1,000 years ago, but just in January, a public health emergency was declared, followed by two months later by the president declaring a national emergency to respond to the COVID-19 epidemic. Early in the spring, the food industry and government realized that with global supply chains challenged by the pandemic, there could be issues with receipt of certain food chemicals, vitamins, packaging, as well as certain food commodities that are imported. Now I would like to present to you Lee Sanders, Senior Vice President of Government Relations and Public Affairs for the American Bakers Association, who will talk a little bit about the industry perspective.
Thanks for this opportunity to participate in today's webinar, April. As the food industry faced the COVID-19 public health emergency, the Food and Beverage Issue Alliance, FBIA, quickly worked together to assess and coordinate on what would be needed to keep the food production operational and staff safe during the pandemic. FBIA is an alliance of 62 FDA-regulated food trade associations, so we represent a diverse spectrum of the food industry. The American Bakers Association and the American Frozen Food Institute co-chair this alliance. When it came to food labeling, and we were starting these discussions really in mid-March, there were three priorities that we were focusing on. One was flexibility for enforcement, discretion for the revised nutrition facts label packaging, and we did receive an additional 6 months of enforcement discretion until the end of the calendar year. Number two was the ability to pivot food service product and production to meet expanded need, to meet retail demands, and we got that, which was great. And then three was regulatory flexibility to allow for minor ingredient labeling changes if there were supply issues. On this third, more complex element, the industry wanted to make sure that FDA guidance would be in place in the rare case that this flexibility might be needed on a very short timeline to either omit or substitute a similar ingredient to keep product production and the food supply chain moving to meet consumer demand during these unprecedented times. Many of the minor ingredients in products are only produced outside the United States. Some good examples of these are folic acid, spices, and bleaching agents for flour. We knew that the supply chain was stressed, especially in China and India, so we wanted to make sure we were prepared if needed. I'm happy to report that today the industry has not had to use this flexibility. As we reached out to FDA on these key needs, we engaged in in-depth and constant dialogue with the agency for over 2 months. Each discussion started with an emphasis on our very top priorities that were and still are for the food industry and FDA to keep food production operational and staff safe, and food safety, which is the industry's historical top priority, and then not introducing new allergens. This also included a commitment to convey this critical information to consumers. Throughout the pandemic, our partnership with FDA has been strengthened. It's really been an amazing journey that continues. The industry looks forward to keeping this productive momentum going as we move forward. I'd also note that industry's been engaged in dialogue with the allergen community to gain their insight on their concerns. Together, FDA, industry, and the allergen community have engaged to strengthen communications and provide meaningful resources on the temporary guidance to manufacturers. I'd encourage the webinar participants to check out our FBIA website with COVID resources. That's www.feedingus.org. That's www.feedingus.org. Provides a wide variety of resources for food manufacturers and trade associations. With that, I'll hand it back over to you, April.
So this page shows some of the things that also contributed to FDA's new policy, and Lee mentioned some of these items. There were marked shifts in where and how food was being used in the economy due to widespread stay-at-home orders and retail closures. Consumers were not eating out, and many restaurants were packing food not just for takeout, prepared food that they made, but also their raw food materials to sell directly to consumers. Firms that previously packed foods for food service distribution also started to sell directly to consumers. So the demand for packaging geared for retail increased, and the government priority overall was to keep the food supply chains open. And this is really, I will say, this is pretty unprecedented. I mean, I know I've been around the food stuff for over 35 years, and I don't think that had ever happened previously to my knowledge. This is all, we are in an extraordinary time. Next slide. Okay, so when FDA developed their policy, there were certain things they wanted to emphasize, such as stating that their preference always is that any formulation changes be reflected on the label. This temporary policy is a flexibility to be used only when such changes cannot be made in due time. And the suggested means to communicate changes are point of sale labeling and website information if they can't be put onto the label. FDA is going to review the need for the policy when the public health emergency ends, and also review the comments received on the policy guidance. They would then let the public know whether or not, in their estimation, an extension is necessary. Reasons for an extension might be continuing supply issues in certain industry that need time to return to normal. This is important because supply chains would need to get back to how they were prior to the emergency. And to date, as Lee has mentioned, there is no knowledge of anyone actually using this policy at this time. So the temporary policy outlines some general factors that should be part of any temporary formula modification. FDA has categorized 6 factors that impact whether a minor formula change can be made to a food product without reflecting that change on the label. As shown, the first and most important is that any change made does not cause adverse health effects and is safe in the food. Second, a minor change means that the ingredient in question is present at 2% or less in food product. And as you may be aware, there's already existing labeling flexibility for all ingredients present less than 2%, in that they may be grouped at the end of the ingredient list. In these situations, it can be possible already to slightly change the amount of an ingredient already reflected on the ingredient list within this grouping. And third, the ingredient that is the subject of the formula change is not allowed to be something that is part of a label claim. So you can't say real cherries on the principal display panel and then leave them out. Okay, next slide. Okay, so fourth, the change cannot be an ingredient that's characterizing to the food. By characterizing, that means it is a major part of the name or flavor, etc. If your maple flavored product has real maple extract and you are no longer using it, this would not be allowed if the maple is a characterizing flavor. Fifth, if your label has a nutrition or health claim such as high fiber, and fiber is not being used at the same level to support the claim, you cannot make that formula change. And finally, the last factor is that the change cannot have a major impact on the nutrition or the function of the finished food. For ingredients that are minor and non-characterizing, you can reduce the amount of the minor ingredient, or you can omit the minor ingredient. For example, you can remove a particular spice that was in a blend. For example, you can reduce dehydrated peas in a dried vegetable soup mix as long as it's not in pea soup. Here's the list of things you cannot do. I've grouped all of these together to make it easier for you to navigate what is and is not acceptable under the temporary policy. Again, as stated earlier, you cannot add a new allergen or ingredient that is known to have sensitivity issues. You cannot make a change that changes the character of the food or is a major ingredient. You cannot make a change that causes harm, and you cannot make a change that results in a claim or label statement to be false. Next slide. What you can do for minor ingredients present less than 2%. I'm going to give you a couple of examples. One way to think of it is to replace a like with a like. For example, tapioca starch could be replaced for cornstarch. If a product has a blend of natural flavorings, you could substitute one for another, again, as long as the flavoring you are substituting is not characterizing. Finally, if you had a lentil sauce and you do not call out on the label the type of lentil, you could switch out one color for another, as long as it is a minor ingredient and present at less than 2%. Next slide. Now let's discuss other types of ingredients. For food acids, which are used in a widespread way across the industry, you would be permitted to substitute one for another, as the example here shows. FDA has not specified which acids can replace others. I am just using these for example. In the case of food colorings, you would be permitted to substitute non-certified colors such as annatto coloring or caramel coloring for a certified color, which are the ones that have an FD&C designation in front. Okay. Okay, thank you. FDA has also made some allowances for certain food ingredients when they are present at more than 2%. As with lower level ingredients, a substitution is allowed when the ingredient does not characterize the food. The ingredient can be replaced with a similar item if there is no label reference to the specific type of ingredient other than the ingredient statement. And finally, for these foods, you can make a substitution of one variety for another. Here, I say different mushrooms or lettuces, for example, if there is no claim on the label about the ingredient. Here's another example. You could substitute curly parsley for flat leaf parsley. Next slide. Fats and oils are another example of an ingredient present at over 2% that can have temporary substitutions. However, there are limitations. The oils must be highly refined, and the substitution must not pose an allergen risk, and the replacement must come from the same type of source, such as an animal or plant. Highly refined oils are ones that are made by solvent extraction, which is a process that removes the oil from the rest of the seed or grain by dissolving it, and then the solvent is evaporated to leave a purified, protein-free oil. Finally, the oils must have a similar fatty acid profile. So, for example, if you use sunflower oil, you can substitute with corn or canola oil. These are both from plants. But let's say you want to replace sunflower oil with coconut oil. You would not be able to do this because coconut oil is very highly saturated and the sunflower oil is not. Their fatty acid profiles are not similar, even though both are from plants. A cold-pressed oil is not considered highly refined, so you cannot make substitutions using cold-pressed oils. Next slide. Sometimes labels will make claims about the geographic origin of a food product or ingredient. Under the FDA temporary policy, you are permitted to substitute the same ingredient from another place, even if you have a label claim about the origin, if the pandemic has caused a short supply. I provide an example here of Mexican paprika instead of Hungarian paprika, or substituting another cinnamon source for Saigon cinnamon. Okay, next slide. Finally, flour bleaching agent is an ingredient that is a food chemical normally sourced beyond our borders. There was a concern among flour processors that the bleaching agent supplies used for flour may be limited due to the pandemic's reach in other countries. FDA has provided that in these situations, flour that is unbleached may be sold as bleached flour even when it is not. This is the case where flour is the end product or if it is used to manufacture another food. Next slide. Finally, during the pandemic, because of the packaging supply chain issues, FDA determined that it was in the best interests of the food distribution to not object if vended foods do not bear calorie labeling as per a regulation that was published in 2016. The rationale behind this is that packaging changes are hard to make during the pandemic. So I'm going to talk about some examples right now. I wanted to provide an example, a potential real-life example about ingredient substitution. Let's say you make a mixed fruit jam that normally has proportions as shown on this slide. And let's say you can't get many blackberries, which would be a real bummer. So you add what you can at 5% blackberries instead of 25%, and then increase the other berries, the strawberries and the blueberries, at a higher proportion in your formula. If blackberry was not a characterizing flavor on your product and you didn't claim it specifically on your label, you would be permitted to temporarily change this jam without a corresponding order of predominance change on your label. Okay, next slide. This is a vegetarian paprika as an example. This is a product that has a claim on the front, made with Hungarian paprika, and the product has several spices that are in short supply. And I provided a list of ingredients. Hungarian paprika is not available, but Mexican paprika is. Yellow lentils are not available, and brown lentils are available. So what can you do? Next slide. Because the Hungarian paprika is a geographic origin claim, you would be allowed to substitute Mexican paprika for Hungarian paprika. It is still a paprika and you're not changing the level. This is not a characterizing flavor change, it's only a geographic one. Insofar as the lentils are concerned, the color of the lentils is not being called out on your label, and so you can switch the brown lentils for the yellow ones, even if they are present at over 2%, like for like. You did not change the nature of your product. Okay, and I guess that's it. So I guess we can open it to questions.
All right, great. If you have any questions, feel free to enter them into the Q&A box. We've got a couple that have come in. So our first one is, does ingredient flexibility allow companies to omit or substitute any ingredient?
I'll take that one. No, an ingredient cannot be characterizing, and FDA is very specific about the levels of the ingredients that must be changed. If it's only certain ingredients if it's over 2%, but if it's less than 2%, there's more flexibility.
Thank you for that. Next question, would you please review again the disclosure options for allergenic consumers?
Lee, would you
Sure.
care to speak to that?
Sure. Yeah, this is Lee. I'll be glad to talk about that. So the temporary guidance provides for a couple of different options. And I know that manufacturers, when they're looking at these, you can certainly have more than one option that you exercise. So certainly posting it on the manufacturing company's website. Point of purchase is another option. FDA has noted that stickering is also an option. And I know in talking with some of my members that they are also, if they have to exercise that rare flexibility, they would consider shelf talkers, which would be displayed, at the site of where you're selecting your product from the grocery shelf.
Okay, thank you. The next question, is it appropriate for consumers to contact food manufacturers to ask about changes to products or manufacturing processes?
Yes, this is Lee again. Yes, in fact, the consumer affairs departments at food companies often get those kind of questions. They are very sensitive to the needs and concerns of allergic consumers. And so if you need more detailed information, you're always, encouraged to call the company from the product. That information can be found on the label. It's required. So you can call that number, get additional information, and they can tell you about the process and the facility itself.
All right, thank you. We have a question regarding soy. Is it pronounced lectin? I'm sorry. Is it soy lectin? Is it considered an allergen?
Yeah.
If it's considered derived from soy oil, which is not an allergen?
I know that FDA has written several papers, I believe, with guidance to industry about soy lecithin. I think at this point in time, producers are required to state that the lecithin is where the source of the lecithin is, like from soy, especially if it's soy, or from a major food allergen product. Actually, I don't believe the lecithin is from the oil itself. I think it's derived slightly differently, but I would need to look into that. I believe most people state the lecithin source when they put that ingredient on the list. So I hope that's somewhat helpful. But I know lecithins come with different purities, and it may have to do with if there's any residual.
Thank you. We're just waiting for a couple other questions to come in. Okay, here's one. If a manufacturer applies the temporary policy for certain lots, are there any recommendations regarding record keeping for FDA or state inspections? Great question.
Yes, it is. I believe, in my humble opinion, I would think it is best to document if you are making these changes that are not reflected in your ingredient statement. I believe that it would behoove a manufacturer to keep very good records of exactly what you did and which lots have the change in it. First of all, that protects you if you do get contacted by consumers and you are able to respond to their questions. The second is, yes, if a state or FDA inspector should come through the plant, you would be able to show your documentation as to what you did, how you did it, how much, and all that. I think record keeping is very, very important. FDA in their guidance doesn't really specifically tell you what records to keep, but I think it would be very smart to do that.
Okay, great. I don't see any other questions coming in, so I want to thank both Lee and April for their presentations today. And thank you all for joining us and your interest in EAS. I'll just mention a few webinars that we have upcoming. September 1st, Understanding and Mitigating the Risks of Emerging Pathogens. September 20 is Food Hygiene Best Practices. September 24, we have Prop 65 and the food industry. And of course, since everyone in the audience is interested in labeling, we do have our food and dietary supplement labeling compliance seminar, which is being offered virtually this year. And that begins September 14th. And all of the information on all of these can be found on our websites. So thanks very much, everyone, for joining us again, and have a great afternoon.